Tungiasis or Jiggers infection is one of the most commonly neglected public health concern in Kenya, and that is why today I'm going to talk about it. So basically, Tungiasis is a painful skin infection that is caused by jiggers, and just to get you back home, jiggers ndio tunaita funza in Kiswahili. Funza. In Luya we call it embunza. How do you call it in your mother tongue? Comment hapo chini. So this disease started in the West Indies and Central America, and then it spread down to Africa. And here in Africa, actually, as we speak, in Kenya, it has affected more than 2.1 million people. Which parts of the body does jiggers affect? It can affect the areas around the nails. It can affect the plantar surface of the foot, that is chini ya miguu. It can affect the hands, the elbows, the thighs, and even the buttock region, that is the gluteal region. Remember, when it affects the nails, sometimes it hides beneath the nails, so it's very hard to notice them. So one has to be very keen when managing this kind of patients. Tungiasis basically starts with a white patch with a central dark spot, which darkens with time and eventually dies off and becomes completely dark. So these patients will complain of the swelling of the area, that is edema of the area, the redness of the area, and the place will be itching. The patient will tend to scratch the area. On scratching, there's a possibility that the skin at this area will lose its integrity, therefore cracking, and therefore the bacteria might tend to infiltrate the area, leading to super infection. So when it comes to management of jiggers, there are two ways. You have the invasive way and the common non-invasive manner. By invasive, I mean mechanical extraction of the jiggers from the site of infection. And sadly, out of desperation, these patients will try to manually extract these jiggers from the site of infection using non-sterile equipment such as thorns, glasses, needles, and sometimes hair clips. And by doing this, you can be sure four things might happen. Number one, it's very painful. It's a very painful procedure. The second part is that they might introduce bacteria to the site of the infection, leading to super infection. The fourth thing that might happen is that when they're doing this, they might rupture those jiggers inside, leading to inflammation. And traumatizingly, these patients tend to share these needles and these non-sterile equipment with others. And when they share it among themselves, they might lead to the spread of infections such as hepatitis and HIV. Therefore, mechanical extraction has to be done by qualified healthcare workers who will make sure that these procedures done using sterile equipment in sterile environment. The second part after mechanical extraction is thorough cleansing and washing of the area. After that, you can apply topical treatment such as dimeticon, which basically causes asphyxia of the jiggers, leading to their death. Dimeticon with low viscosity is the best treatment modality for jiggers. After that, check the status of tetanus vaccination for this patient. If they have not received the right vaccination, make sure you give them a booster vaccination for tetanus. That is the invasive part. But for ground, how do we manage jiggers? We have heard of potassium permanganate and Vaseline. These are the best or the most common regimen that are used in Kenya right now to manage jiggers. It is non-invasive, it is painless, and it's considerably quicker. So the first thing that you do, number one, you need a basin, clean water, potassium permanganate, soap, Vaseline, and of course you need the patient. So the first thing, you put on the gloves, you identify the affected area, then you thoroughly wash the affected area. Let's say it's the foot. Thoroughly wash the foot using clean water and soap. By doing this, you're trying to identify the extent of the infestation. So the next step is the treatment stage, whereby we dip the affected area into the potassium permanganate solution. So basically, how do you prepare this potassium permanganate solution? You take 5 liters of water, 5 liters of water, you kibuya 5 liters, then you pour the water in the basin, then you add 1 tablespoon of potassium permanganate, then you stir. Then you take the affected foot, let's say it's a foot for this example, you take it and dip it inside the potassium permanganate for 15 minutes. After that, you remove the foot and then you let it dry for about 10 minutes. By doing this, you'll be suffocating the jiggers. After that, you apply Vaseline or petroleum jelly, any moisturizing solution, so that we can prevent cracking of the affected area. This whole process, this entire process of washing, dipping it in potassium permanganate and applying the petroleum jelly has to be done at least 3 times a day for 2 weeks. After that, the jiggers will have cleared. From this point, from this moment, the patient has to put on closed shoes so that we can prevent further infection or further infestation of the jiggers. To the prevention of jiggers, sanitation and cleanliness, taking bath, trimming your nails, airing your beddings. These are the first step of making sure that you prevent jiggers infestation. The second step is domestication of animals. Make sure that these domesticated animals don't live in the same room as you. Wajenge kando, waishi kando. You cannot be living with your chicken or with your animals in the house, because these animals are the carriers of these jiggers. The third step is those people living in manyatas, they have to make sure that they smear their floors and their walls with cow dung. By doing this, they'll be repelling the jiggers. If you have any questions or additions about jiggers or any other burning question, just comment down below, or you can just shoot me an email on the email address written below. See you in the next one.